Hello, PHN Commissioning Conference. It's Brendan here from Northwestern Melbourne PHN, and today I'm going to go and chat to Brad, Sione, and Matthew about a really important project to recommission some alcohol and other drug services. So let's go and see them.
At Northwest Melbourne PHN, we fund about $6 million worth of alcohol and drug treatment services, a whole range of great programs that are really targeted at different sort of communities across the region. A number of them had been in place for quite a number of years. So in early 2020, we took the opportunity to have a look at them and really think about how they align to community need, to PHN priority areas, and how those services worked with other parts of the service system to be responsive to sort of changing demographics in our community. I think what we had heard through community and consumer groups, and particularly when we spoke to Aboriginal people or people from cultural and linguistically diverse backgrounds, that although services were good, they weren't tailored to meet their needs. People often didn't know how to access services, if they didn't feel safe and the like.
So Harm Reduction Victoria is an organisation of people with lived and living experience of drug use. We're a statewide organisation here in Victoria. We provide some services, peer-based services to our community, and we also do advocacy around issues that affect our community in particular. There are a number of identity issues and barriers for people in accessing services because they've been set up over time really to service what was the most common issue or population at a time 10 or 20 years ago or 30 years ago.
We knew from the start that having that consumer, that community, the living experience voice was going to be really critical to what people felt good looked like. To honour that, we work closely with the Association of Participating Service Users and Harm Reduction Victoria. So we established a core group, a consumer advisory group. We also positioned a group that was subject matter expertise, so clinical experts.
So APSU stands for the Association of Participating Service Users. It's a program of SHARC, which is the Self-Help Addiction Resource Centre, and its really primary function is around consumer participation and engagement. It was just really great to hear Brad so committed to making sure the consumers were a fundamental and ongoing part of the work. I remember the first meeting I had with him, he was really frank about that and just said, this is a really important part of the project and I want to make sure we sort of get that right. So, it was great to be able to contribute to a project where him and his team were so committed to making sure that they were included and part of it. So we got involved on the advisory group initially. So I was on that for a period of time leading up to while they were designing how they wanted it to look and representing, I guess, the consumer or service user in that advisory group. And then when they got into the design stage and they started having those sort of focus groups and planning sessions and co-design sessions, I think we ended up with about 10 of our members participated actively in that.
This idea of person-centred services is a great idea, but the power imbalance is so strong and the stigma and discrimination for people who use drugs is so clear and evident that it actually makes conversations really difficult. The way that the process was put together was actually done, I think, with that power imbalance in mind. And so consumers weren't necessarily just pulled into a consultation without any preparation. They weren't necessarily pulled into a consultation where clinicians were over here and consumers were over here, and it was actually done in a way that really foregrounded the experiences and needs of service users first, and then took into account what clinicians and services needed as well.
Brad was really clear that the brief was primarily AOD, but how do we make it more holistic and be able to sort of provide services that matter in relation to other people's needs? And so the group that we had, I think, had a really good spread of the varying kind of co-occurring needs that happen with people that are seeking AOD treatment services.
It's not just AOD use, but physical, mental health and other support like Centrelink. Also to other services that you can tap into, such as gym, financial counselling and housing support.
Counsellors need to recognise lateral thinking and continuous development, that they don't know everyone, and that their knowledge gets outdated. that no one can know all information and it keeps changing, so they need to stay up to date.
There needs to be more emphasis on the good side of what we do, celebrating success and understanding this is the lifestyle I live. Addiction is hard. Some can do abstinence, but not everyone can do that.
So there were 10 principles developed that really set out from their perspective what safe, high quality sort of alcohol and drug treatment looked like or felt like from a consumer perspective. So we included those principles in the tender specifications that went to market, and we really encouraged both not only through the documentation but also our sector briefings to really review and understand those principles and to honour them in any responses.
And I think what was very interesting was that those principles that I talked about before that were brought forward from the consultations into the commissioning process needed to be adhered to, and I was really glad that really the PHN put its money where its mouth was on that one. And so where services adhered to the principles, I believe they were had a better chance of being commissioned moving forwards. And as painful as a process as that might be, I think it's really important that we stick to our guns when we talk about things like this.
Start early. I think setting that 18-month to 2-year process really honoured the work we were trying to do of bringing people together, hearing the voice, testing it, thinking about how we would manage that with providers and then testing it again. I think, having, people with lived experience, that come to groups and ensuring they are safe. So using those two organisations, both APSU and HRV, to facilitate that connect. So rather than us using, our relationships to try to find people, I think using those two well-respected organisations that have support mechanisms around consumers and, it's core business for them. So I think building relationships through those organisations was really valuable and continues to be so.
I think that the involvement of Harm Reduction Victoria and Shark, even at the advisory group level, gave a bit of an imprimatur of approval for the community.
We know that sometimes engagement can be, it can be sort of, I don't want to use the word triggering, but it can be problematic for people. So we make sure that we have a full debrief process as well. So the person that ran that project got in touch with all the participants afterwards and had quite a long phone conversation with them to understand how they went and whether they had any questions or concerns. So we walk beside them through that whole process essentially.
Co-design is the way forwards. The only thing I would mention around that is that it, like I said, it does have a large impost on the community and the organisations that work with them. And so if we were to replicate this approach across all of the PHNs or across all of the commissioning processes in Victoria, there is no organisations like Shark and Harm Reduction Victoria would be doing nothing else than being part of them. And so we have to think about how we do that and make it sustainable for the community as well.
And I think it's proven out of these, particularly this experience with PHN, but also with the Royal Commission, just how fundamental it is that consumers and service users have an opportunity to contribute to the services that they're going to be experiencing or have experienced in the past. And I guess it's foundational. We hope that it sticks and that lived experience in all of its types and options for engagement become really sticky and just a fundamental part of how things are done.